Hello, my name is Ken Tsai. I'm the Vice Chair of Research and Translational Pathology at Moffitt Cancer Center. I'm going to describe some work about a project that we've been working on for some time, and we've called it Pathway-Synthenic Senescence as a means to augment immunotherapy response. And so the idea is actually that it's been actually known for a long time that many cancer cells have a zone where they can optimally proliferate. So they like to be in this sort of Goldilocks zone where they are able to proliferate and survive in the best possible conditions. And when we perturb cancer cells, we take them out of that range, they proliferate less. So that can be, for example, reducing the activity of an oncogenic pathway down with a chemical inhibitor, or hyperactivating it. And so what's been known for a long time actually is that certain cancers that have mutated RAS can actually upregulate the ERK signaling pathway if you apply certain drugs such as BRAF inhibitors. And so we actually wanted to see whether this could be an effective means of cancer therapy in this challenging group of cancers. And so we did this in melanoma cell lines. We found that if we put BRAF inhibitors on NRAS mutant melanoma cell lines, they actually arrest and become senescent. And so, this project sort of lay dormant for a while until we started to get the idea that maybe this could be useful in the setting of immunotherapy as well. And it turns out that actually if you take a cell line that is mutant for NRAS, you put this drug on, you can actually inhibit, if you look at the red curve there, inhibit tumor growth when you combine it with immunotherapy, in this case, something that's called anti-PD-1. And in fact, when you look at the CD8-positive cytotoxic T cells that are responsible for this effect, you can see that they show markers of activation only in this case where you've combined the BRAF inhibitor and the immunotherapy. And so we actually then subsequently validated this in a pancreas carcinoma mouse model as well, which is driven by a different mutant RAS. And then we were able to collaborate with Dr. Kim, Daewon Kim at Moffitt Cancer Center, who's a GI medical oncologist. He had two patients that had exhausted all therapeutic options and was able to put both of them on a BRAF inhibitor as a single agent for a short period of time. On the left is a patient that temporarily responded to the therapy. That patient actually had a very high expression of mutant KRAS in the tumor. And so this patient temporarily responded. You'll see in the red curves a tumor marker actually stabilized while that patient was on therapy. And then in another case where a patient had a very low expression of the mutated KRAS, that patient did not respond at all, unfortunately. So we're very interested in this concept of hyperactivating oncogenic pathways, trying to study what the consequences are, and seeing whether or not this might be a generalizable approach to sensitize difficult tumors to immunotherapy.